With wisdom teeth, I guess as an oral surgeon, you do a lot of them. So what are their questions? What are their fears? What do they need to know?
It's a pretty straightforward procedure. It's something that I do every day. One of the most frequently asked questions is, how long does it take? It's usually a straightforward procedure, 10, 20, sometimes 30 minutes in the office, and then another half an hour to 45 minutes to recover from the procedure in a recovery area.
Now for kids, how long do they have to be out of school? Ideally, what's the fastest you can go back?
Some kids go back to school the next day. Some kids need a couple days to get out, to stay out of school and recover. It all depends on the level of difficulty it is to get the teeth out.
All right, all right. Now, why go to an oral surgeon if you're going, because a lot of people now are doing, I guess, you know, in the old days, not too long ago, oral surgeons were the only ones taking wisdom teeth out. Why go to an oral surgeon?
Well, this is a procedure that I do 5, 10, 15 times a day. It's also a procedure that I've been specifically trained how to do. And the one thing that an oral surgeon is licensed to do in the state of California, unlike any other provider, is to provide anesthesia services while they take the wisdom teeth out.
Okay, good point.
So when I had my wisdom teeth out, I went to an oral surgeon because I wanted to be asleep. I didn't want to know what was going on for the procedure, which, you know, it's not the most pleasant thing to have done in your mouth, so I want to be asleep when I'm having it done.
So what's changed over the years? Has it gotten better as far as extracting wisdom teeth?
One of the things that's come about recently is the ability for the oral surgeon to use a CT scan to image the wisdom tooth. And that helps us make a diagnosis on whether or not we should observe the wisdom tooth, especially if it's close to the nerve or the sinus in the mouth, or should we take the wisdom tooth out? And where is the anatomy in the area where we're working? It helps me develop a surgical plan to get the most effective treatment done and the best procedure done, the safest for the patient.
Now, I guess people wait until they're in pain. So for the 30 plus, 40 plus, 50 plus, they're still coming in for wisdom teeth. Is that right?
They are still coming in for wisdom teeth. I had taken out a wisdom tooth on a 104-year-old lady who had an infected wisdom tooth.
Really?
So we can end up taking out your wisdom teeth any time in your life. A lot of times they won't become more symptomatic until you're older, which makes it a lot harder for me to take it out because usually there's concomitant medical problems that come along with that patient.
Okay, they also call these third molars. Is that right?
That's correct.
Okay, help me understand, if humans were born with these wisdom teeth, why take them out if there's no pain, no symptoms?
A lot of times what we're trying to do is prevent orthodontic movement of teeth, especially after kids will get done with their orthodontics. We'll end up taking out the wisdom teeth because the orthodontist doesn't want his alignment to be affected by the growing wisdom tooth.
So for cosmetic reasons, because later it will what? Move the teeth?
It can move the teeth. It can also damage the second molars, which are teeth that we want to keep and use to chew.
Okay.
They can also be the harbor for bacteria that can cause problems throughout the whole body.